What could be done to sustain a regular supply of medical aids that could serve as critical interventions in the fight against coronavirus, such as face masks, hand gloves, and sanitizers? How can the body of pharmacists in Nigeria collaborate more effectively in the face of this clear and present danger to public health in Nigeria? We've been having conversations about what interventions to make in order to halt the spread of coronavirus in Nigeria, both at the government and private sector levels. This morning, we're about to expand that conversation by speaking with Sam Ohuabunwa, Chief Executive Officer of Nimet Pharmaceuticals and President of Pharmaceutical Society of Nigeria. Welcome to the program, sir. Good morning.
Thank you very much.
Good morning, sir.
Thanks for
Good
being
to have you here. Thank you for coming to the morning show.
Yeah.
Now, first, let's start with Nigeria's level of preparedness for the threat of coronavirus, if not the scourge, if not the menace of coronavirus. From what has been done so far at all levels, the Federal Ministry of Health, state governments, the National Center for Disease Control, and assurances that have been given even by the presidency, will you say we're prepared? Will you say we have learned lessons from the Ebola virus and we are much better prepared now?
Well, first, let me correct that I am the past chief executive of Nimet, not the current president. I'm retired from that assignment.
But you're still very active as a pharmacist.
No, I'm not. I'm on the board of Nimet. I mean, I'm the founding CEO, so I'm still on the board. Just to make the facts correct, I'm also the president of the Pharmaceutical Society of Nigeria. So I'm in the industry and understand all that you've said. I believe that the level of preparedness should have been better than it is. The saving grace that we have is that we have had an experience in managing crisis like this, which is the Ebola crisis. That has given us some residual experience in the work. But beyond that, we ought to have done a lot better, because I believe that when the first signs came, when the first news broke, I would have expected an effort to try and increase the level of preparedness, especially with acquiring medicaments and things that will have been used for managing the illness. Because it was certain that if such an epidemic had blown open the world, that Nigeria was going to be part of it, given our level of interaction with China, and in fact our involvement in global trade, and the fact that Nigerians travel all over the world. So our level of preparedness should have been better. I think we need to do more. We need to be more proactive than we have been. But I think the Ebola experience and some of the residual experience has been helpful here.
That's good to know. At least we're not completely taken unawares, even though we have a long way to go. But I'd like to address the short video that we showed before and get your thoughts, obviously, as a professional. Now, that video was a demonstration on the efficacy of hand sanitizer, using E. coli as an example. It must be stressed, E. coli is a bacteria. Coronavirus is a virus. The two are completely different. So, but it's also important to state, hand sanitizers can be effective for a virus as long as they contain 60% alcohol or more, because coronavirus, luckily, even though it's quite a scary threat, it's an envelope virus which will respond to alcohol and be destroyed by alcohol. If it was another kind of a virus like that rhinovirus, all the hand sanitizer in the world will not help you. But hand sanitizer will help, but it must be stressed that it's not a bacteria, it's a virus. But that the best defense really is running water, soap and running water. And it doesn't, I wanted to really stress this point, because soap is not antiviral in any way, but it's the washing of hands and running water and rinsing thoroughly for 20 seconds, and also drying your hands with a disposable paper towel, not using the same towel that might have been contaminated. Use it once and throw it away. That's very important, since hand hygiene is so important. I just had to say that in response to that video. But to my question to you, sir, what is your response to the federal government clamping down on some pharmacies that have been accused of predatory practices, like hiking up the price prices of hand sanitizers, and that, the Federal Consumer Protection Competition Commission has come out with a statement saying that this is illegal and that they should be sanctioned for doing that.
It doesn't make sense. We are not a country with controlled price regime. It's a free market, and there's a natural market response to scarcity. You can't decrete. The moment there is high demand for any product, the price will change. It is standard. Not only will it change from the retail point, it changes from the source. The producer, the distributor, respond. When demand falls, prices go down. So it's not the right thing to do to start pursuing people around and talk. We're not in a price control regime. Of course, we believe, for example, as pharmacists, we already issued advisory to our colleagues to do the utmost they can to ensure that they do not profit from the misery and from the problems that we are facing in the country. That is something you can do as moral suasion. It's not you cannot legislate it, because the response to demand everywhere in the world is that prices change when the demand changes. So using consumer protection agents is very primitive in this kind of circumstances. You might even cause more problems, because suppose guys don't even bring it to sell at all. What will happen? Because they're afraid you're going to come and hold them. We shouldn't put, as I said, don't add salt into injury, or where you are treating an eye problem, you bring pepper. I think the issue is, let's increase availability of the products. And this is what I said, that part of our preparation was lackluster. We ought to have anticipated this. We'll have given, in America, they have given orders to pharmaceutical companies. They have all the money that the president is looking from the budget is to buy equipment, buy medicaments, buy masks, buy hand gloves. They didn't wait till it became an issue to buy in retail shops. They will buy and then supply. So government ought to have done that, anticipating this. The pharmaceutical companies are primed right now as I speak to you, based on our advisory, to increase production of these things. But some of them don't happen overnight. And what is worse, a sizable proportion of the raw materials we need come from China to do some of this. And China has become a difficult place to trade on. So that complicates the issue a little bit. But I want to assure that the pharmaceutical industry is primed. The pharmacists themselves have been given advisory not to benefit. The natural response is what happens, but we're talking to them as professionals to do their best to keep the prices low. It's by moral persuasion.
Certainly, and it's interesting because when I first, of course, heard that the government was trying to place some sort of sanction on pharmaceutical companies that were trying to or had increased prices of these products, at first I was like, yes, that's good news, But after having it broken down by you and a previous guest as well, you cannot forget that you do actually have to let the market operate. However, it's interesting because Nigeria is also a unique situation. Yeah. This is a country that has over 100 million people living in absolute poverty, and we all already know that if coronavirus was to have an outbreak in Nigeria, which for now it's being contained, which is great, then these are the people that are not going to have access to these products. However, it brings up, of course, a greater question of the role of government, the role of the private sector, but that's what I wanted to talk to you about, the role of pharmaceutical companies in doing what they can to help in situations like this. Yeah. Are pharmacists supposed to be educating people that come in that, okay, no, actually, you don't need to spend your money and buy a surgical mask because you're not someone who needs it? Yeah. What role should pharmacists be playing at the forefront to try and provide some sort of moral support from their education, their expertise in the field, seeing as, of course, like you said, you have to let the market work?
Wonderful, wonderful contribution. I think that's the role. All the professional pharmacists today appreciate the fact that they are some of the closest neighbors, first line of touch by many people who need medical aid, who need health advice. They go to pharmacies in many climes, not just in Nigeria. And therefore, they take that responsibility seriously. One of the first advisories we issued when we became president of the Pharmaceutical Society of Nigeria was that no patient should come into your pharmacy be it in the hospital or in the community setting, and leave without getting some opportunity to interact with you, with a pharmacist, and get canceled. First of all, you shouldn't sell a medicine because somebody asked for it. You must find out why does he need the medicine, and did he ever use it? Is it a prescription medicine, an OTC, even OTC medicines? We say doctors may not prescribe every medicine, but you must talk to your pharmacist for every medicine. Because whether it is ethical or OTC, you need the counseling. Each one of them has their problem. So on this particular case now...
we have to go on a quick commercial break.
Okay.
Do hold your thoughts, and when
right.
we're back, the conversation continues. Stay with us. Welcome back to the morning show here on Arise News. Mr. Sam Ohuabunwa, the former CEO of Namath Pharmaceuticals, current board member and also president of the Pharmaceutical Society of Nigeria, is still here with us on the program. Thanks for staying with us. Before we went on a break, you were talking about the role of pharmacists, the advice given to them, etc.
Yeah, I say that even in this particular case, since this epidemic broke out, there has been a protocol that has been sent to all pharmacists to ensure, first of all, that every patient that comes into gets a briefing. We have also asked them to provide some flyers, that people can take away so that they can be educated, even if what they came for didn't have to do with any infection at all. It's part of the primary service, because we regard pharmacies as the first line, especially in primary health care. And because they are distributed all over the country, they reach the patients and the public pass faster than hospitals do. So that's what we're doing on an ongoing basis, and it's being intensified at this time, because just like you said, it's interest of everybody. Even though somebody says that in the land of a disease, a good market for a medicine man, but we don't want people to be diseased. We want people to feel well. There's a lot to gain if people are healthy. And today, as you know, there's a growth in health maintenance medication, not just people who are sick, who are looking to be healthy and have an enjoyable life. So pharmacists are in the forefront.
Well, I mean, there is a lot of concern out there globally about finding a cure for coronavirus, particularly this new strain of coronavirus. And here in Nigeria, Professor Maurice Iwu, who is a virologist and head of the Bioresources Center, claims that he's been able to find a cure for it. And I saw a picture showing him meeting with the Minister of State for Health, the Minister of Science and Technology, and some other federal officials. Is the Pharmaceutical Society of Nigeria, or maybe Namath, involved in this process of finding a Nigerian cure, if you like, a cure to coronavirus? And why does it take up to 18 months to get the drug ready? Because when you read all the reports, either from Israel or the United States, or even probably from here in Nigeria, what you get to hear at the end of the day is that it will take 18 months to find a cure. And that even further deepens public panic and anxiety.
Yeah, well, first is that, with due respect, research is low in our country because it's an expensive thing to do. And Nigerian governments, I'm not saying governments, past and present, have not come to the full realization of the need to invest in research and development. We have not come. How do I know? I have served on the board of several research institutes in Nigeria, including National Institute of Research and Development, National Institute for Pharmaceutical Research and Development. I'm currently on the board. If you walk into that place, you'll be sorry for the institution, because the walls are broken. Not talk of equipment and not talk of funding. It is a shame. Go to our universities, there's not enough investment in research and development. And so we have to depend on the rest of the world. What a shame. But having said that, there are a few companies, and with due respect and modesty, some pharmaceutical companies, mine included, the one I worked for Namath, in doing research and development. For example, Namath was the first pharmaceutical company to come out with a local remedy developed from local research for the management of sickle cell anemia, which is one of the neglected diseases of the black man. And in these other areas we're in, and an interesting thing you might like to know, I don't know whether I should disclose it here, But there's no harm. Professor Morrissey, who is on the board of NIMET International Pharmaceuticals, right from ways when he was in the university and thereafter we have related with him because he's a research guy. And even when he was in the United States, we've tried to develop some of his work, to bring them to market. So we're working with him in these and other areas. We're asking that government should show more interest because investment research is a long term. And why does it take long time? First is that for every product that gets to the market, you have spent between about $500 million to get a product to the market. 10 others have failed after you spent so much money on them. The reason is that first you have to go through several trials. You have to go to phase 1, phase 2, phase 3. The moment you discover that the product is effective, you then have to, first you prove its effectiveness, then you prove its safety. If it is very effective and unsafe, you can use it. There must be a balance where the effectiveness overrides the safety considerations. So you do clinic first, phase 1, phase 2, phase 3, phase 4, starting from lower animals, rats and cats, and then you move on to other animals. You get to human beings, and then you do restricted trials, controlled clinical trials. No matter how good that medication is, there's a requirement that it goes through those trials. First is that a product can be useful on day 1, but on day 50, it will cause you problem. So you need to allow the product a number of days to see its short-term, medium-term, and perhaps long-term toxicity. Even when a product is on the market, that's what we call post-launch surveillance, pharmacovigilance. You're still monitoring the efficacy and the side effects because some of them show up from chronic ingestion, not at acute ingestion. And that's why NAFDAC and those agencies set up pharmacovigilance centers all over our hospitals and our medical centers to monitor. So you can't bring it that quickly. Of course, in some circumstances, some countries have given exceptions and say, when they look at the crisis, they say, bring the drug as long as it works. Because if the mortality is so high, and then the disease will kill you all the same. So why don't we try saving you? But we're happy that coronavirus has a low mortality rate, so it may not require that kind of extraordinary position of bringing any drug that has some efficacy without establishing some level of minimal safety. That's why it takes these 18 months to be able to be licensed to be used in human beings.
That's good to know. They should take all the time they need so that there are no unwanted side effects.
Yes, you're trying to heal one problem,
and
then you land another one.
Yes. Yeah. But now, with regards to the possibility, well, I don't want to talk about the possibility of having this huge pandemic, but coronavirus, if at all everybody manages to escape it, or most people manage to escape it, could still have adverse health effects to people who do not contract it, in the sense that common antibiotics, common vitamins might become scarce because India's vast drug industry is already reporting challenges because of the global dependence on China for so many raw ingredients and components for different industries. For pharmaceuticals, a lot of the raw ingredients come from China. India is saying that they might not be able to serve Indian consumers, much less export. What is the outlook for Nigeria?
Well, it's a wake-up call, guys. It's a wake-up call. I just wish that Nigeria will just listen and take a cue. In this country, there's plenty of flora and fauna that have pharmaceutical and medical uses. Indeed, what they bring out from China, some of them are existing here. It's a matter of ability to process them and put them in a manner that they can be marketed. We have the substrates, we have the potential to build up a formidable pharmaceutical subsector, building from an area of competence, an area of endowment, which is what we call the herbal medicine. The herbal medicine or phytomedicines are things that are available in our climate. We don't need to go to China. But the point is that pharmaceutical companies have to go to the banks and borrow money at double digit, and then you invest it in 10 years or 5 years of research, and you're paying interest, and the research is not bringing you money. So it may even fail. part of the reason our company, with due modesty, we haven't done, in quotes, as well as some other, that we've been investing in research. You take short-term money and put in long-term investment. It doesn't work. And so every once in a while, you feel like you're burning your fingers. But then you're doing it because the sustainability of the pharmaceutical industry everywhere in the world is innovation, research and development. So I think that our country, Nigeria, should take a decision now, because there will be another virus. I don't know the name, but and I'm not a prophet of doom. Why don't we start preparing for that now? Get the research institutes and give them a mandate. Get the teaching hospitals or the universities, give them a mandate. Get industry, give them a mandate. By the time the next illness breaks, we would have gotten some minimum level of preparedness in terms of what medications we can use. We can't predict that. For now, I believe that the local industry is doing its best to provide those supportive medications you're talking about, the ones that boost immunity, because essentially when you're treating viral infection, what you're actually trying to do is to boost immunity, because the moment the immunity is strong, using things like glutathione, looking at like vitamin C, things like dimethyl superoxide, such things.
You're already dispensing drugs on television.
Such things help to boost. So I think that in the country that there's a lot of effort to make sure those ones are available. Even if we don't have a specific antiviral medication for treating coronavirus or any other virus, including Lassa fever and the other ones that hurt us. If we build our immunity by taking some of these medications, which local industry is working on, then we will reduce either the mortality or the morbidity of any of these infections, whether they be viral or bacterial.
Absolutely. And speaking of level of preparedness as well, let's move away from pharmacy itself and speak about something else, travel restrictions. Now, this has been a big topic around coronavirus and its outbreak. Angola, for example, have placed travel restrictions on all countries, and there are other countries that have placed travel restrictions on high-risk countries. Now, here in Nigeria, we have not actually gone ahead with any travel restrictions yet, even though we already have a case in the country. And it can be argued that these are steps we should have even taken before we got a case in the country. What is your take on the government's response to this? As a pharmacist yourself, do you believe that right now we should be having strict travel restrictions from certain countries coming into the country?
Or maybe we should shut down schools?
Personally, I don't believe in travel restrictions. I don't, and WHO does not recommend it. It does not change matter significantly. The issue is to have a proper ability to investigate and prevent. If all the people who come into our borders, it's only in a country where you don't have proper border control, even when we say we have shut them, that you have issues. But if you have a proper border control, and as people come in, because there's an entry gate, as they come, you put them through some investigation. Like now, they are doing quarantine, 14 days quarantine.
I'm sorry, sir. We've got to end the conversation now. But thank you so much for joining us this morning.
Thank you very much.
Thank you.